What tests identify esophageal sphincter dysfunction for GERD? Imagine trying to close a door that keeps swinging open. That's similar to what happens when the esophageal sphincter doesn't work right in gastroesophageal reflux disease. To find out if this muscle isn't doing its job, doctors use specific tests. The most common one is called esophageal manometry. This test involves inserting a thin, flexible tube through your nose into your esophagus. The tube has sensors that measure pressure and muscle movement. When you swallow small sips of water, the sensors record how well the muscles contract and relax. If the sphincter doesn't close tightly or opens too often, this test will show it. There's also a more detailed version called high-resolution esophageal manometry. It uses a special catheter with many sensors to give a clearer picture of how your esophagus and sphincter are functioning. This test is especially helpful if surgery is being considered, as it shows nerve and muscle issues more precisely. Another way to check for sphincter problems is ambulatory pH monitoring. During this test, a small tube is placed in your esophagus to measure acid levels over a full day. If acid frequently appears in your esophagus, it indicates the sphincter isn't blocking stomach acid properly. A newer version, called Bravo pH monitoring, uses a wireless device attached during an endoscopy. This device records acid reflux over several days without the discomfort of a tube. Impedance-pH testing is also used. It measures electrical resistance in your esophagus to detect both acid and non-acid reflux. This test is useful if you have symptoms but don't show much acid in traditional pH tests. It can reveal if non-acidic stomach contents are refluxing, which can also cause discomfort. All these tests help doctors understand how well your esophageal sphincter is working. If they find it's not functioning properly, treatment options like medications, lifestyle changes, or surgery can be tailored to fix the problem. Knowing which test to use depends on your symptoms and what your doctor thinks is causing your reflux. These tools are essential for accurate diagnosis and effective treatment planning.